Can I get a chopping board?
Oh, okay, yeah. Okay.
And anyone who's speaking, you can turn them off as well.
If anybody talks to you
comes on.
It's 8 on the job.
Okay, guys, are you all ready?
There's like name.
All right, so it is 10 o'clock or just gone after 10 o'clock. So really good to see you. Very welcome and very warm welcome on this snowy morning in Ealing Town Hall. Good to be back here after some time, and you should all have your papers in front of you, and those who are on devices, you should be able to follow the meeting as we progress through the agenda items. But we were hoping to be joined by the mayor or the chief executive. I can't see either of them to welcome us. They may well be running late, but I'm going to ask my colleague, Dan Crawford, the Ealing councillor, to formally welcome us to this beautiful parlour or beautiful chamber.
Thank you, Councillor Sheff. Yes, I'm the understudy to my colleagues, far more glamorous and more important than I. But we're very pleased to have you here in Ealing Town Hall and in our council chamber. And I should say, for colleagues who haven't been here before, the toilets are directly outside. The ladies is on your right, the gentlemen's toilets is on the left. If anyone requires anything, just let me know, or Anna Marie, we can get some more water and drinks for people if they require it. Thank you.
Thank you very much. And today being the International Women's Day, a very happy International Women's Day to all of you and those who are joining on the screen as well. And talking about screen, we are going to be joined by Mayor of London's office as well as Nuffield Health, particularly for the first substantive item. So welcome to the colleagues from the City Hall as well. There is a helpful guide to guide us through the declarations. So let's deal with the declarations and the apologies. And let me ask Anna Marie to first of all take us through the apologies.
I haven't received any apologies, Chair.
Thank you. So then, as I was saying, declaration of interest. So I am the lead governor of Central and Northwest London NHS Foundation Trust. Colleagues, are there any other declarations to make? No. Thank you. Then the deputation, we are back with you, Anna Marie.
So no deputations received, Chair.
Thank you very much. And the next item then is minutes of the previous meeting, which seems like a long time ago, but thank you to our colleagues in Kensington for hosting us and producing this excellent minutes for us. So can we take those minutes as tabled? Thank you very much. And are there any matters arising from those minutes which is not covered elsewhere? Thank you. So then we come to our first substantive paper this morning, the Elective Orthopedic Centre and the summary of consultation and proposals. And before I invite Pippa, the Chief Executive of Northwest London NHS Trust, let me just say that it was really good to go and see the service, which is likely to be going into the local hospital, subject to what we say and subject to it going through the usual channels. But certainly the visit was incredibly helpful and beneficial. It gave that extra context to just looking and perusing the papers. So it was hugely welcome, certainly by me, but having had the feedback from my colleague, it was really useful for all of us. And I hope going forward, there'll be many more such visits in coming weeks and months. So thank you very much to your colleagues, Pippa, for taking us around the hospital and giving us that very helpful insight. So let me now welcome you to this morning's meeting. And if you could please take a minute or two to give us the key headline of this particular paper before us this morning.
Thank you. Happy International Women's Day, everybody. And no, thank you for coming to site. I must say, I think COVID has changed the way we work and we need to get back into normal ways of working. You are certainly all our partners and you're all very, very welcome in our hospitals. And it was great to have you on site, actually. So absolutely, I think we're all committed to working in that way in the future. So I'm not going to go through the full details of this paper. You can see it's very chunky, but to give you the outline. So last time we were here, we were giving you the outline proposal of the elective orthopaedic centre. An awful lot has happened during that time. I can't remember how long ago that was now, but what we've now had is a public consultation. So this is really to give you the detail of the public consultation and to talk you through the next steps of the process as well. So I think what I'd like to say is thank you. You really supported us all in your OSCs. It was really helpful to access members of the population, actually, which I think, again, we need to be minded. You've all got great accesses into your population. It's really important we work together to do that in the future. But what that showed is a really successful consultation. So 1,959 people responded either through face-to-face and online. And I think it was really important we had both of them options because we got a real different mix between the face-to-face and the online, which gave us a really good spread across the boroughs, but also across the diversity within North West London of our population, which is so important. We hear them voices. So I think the learning for the future is the number of different ways we engage, the more we get that partnership across North West London for our population. And that was really important to see. Just on the outline, what you can see is the overarching 59% agreed, 31% disagreed. You will see the detail in there of the types of people who agreed and disagreed. And you can see there is a larger proportion of members of the public that agreed. The biggest proportion who disagreed were actually staff members. And we recognise there is more to do moving forward in terms of engaging staff and the whole change process that we need to go through with staff. And that's certainly a journey that we're committed to. What I would just say is we've had some great assurance in this, actually, and lots of great insight and learning. So this has been to the London Clinical Senate and some great insight from there. It's also been through the Mayor's 6 tests. So Nuffield were the partners appointed by the Mayor to do that. And again, another great assurance and some great insight. But all of them, as well as the consultation, tells us really the 5 themes that we knew at the start we needed to do work on, and that's where we've based the detailed work throughout the decision-making business case. So they are around travel, they are around site location, clinical model patient experience, workforce model and staff experience, and equity for our population and also for our staff. So the next step then, this will go to the North West London Integrated Care Board on the 21st of March. And what we're asking today is for the North West London Joint Overview Scrutiny Committee is to provide feedback into that paper that will go to the Integrated Care Board. But rather than saying anything more, I'm happy to take any questions.
Thank you very much for that, Pippa. Really helpful to have that oversight. You just referenced Mayor's 6 tests. You mentioned Nuffield, who were commissioned to do a piece of work around that, and I know they are both online with us this morning. So you have referenced the Mayor's 6 tests, and I just want to understand a little bit more how this aligns to those 6 tests, please.
So what we've done is pulled the recommendations together. We obviously have to respond to